Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain-Free with Dr. Marc Darrow from the Joint Rehab and Sports Medical Center in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified through his studies at UCLA, and Dr. Darrow uses stem cell and platelet-rich plasma therapy to heal your body. He teaches about the use of stem cells, PRP, and prolotherapy. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Nita Valens.
Hi there, Dr. Darrow.
Hello, Nita Valens. Are you living it up like I am?
I am.
Okay. Let's have a fun show today and talk about how people can heal their musculoskeletal pain without surgery. That's the keynote here. No surgery. Sometimes it's needed, but I'd say 99% of the time it isn't needed. And it is the culture of the medical community to do surgery. You know, my kids have all wanted surgery when they've injured themselves in their sports because that's what everybody does, right? And right. I've kept them away from it, thank goodness. And I've been able to help them with regenerative medicine, which is using stem cells and platelets. And everybody's doing good, including me and including you.
That's right.
We've had it too.
We have.
And I have injured myself over and over and over from being a crazy sports addict, and I'm doing good. I'm going to go running in the mountains with my husky today. Poor Dakota, he can't run anymore because he had an ACL surgery on his knee that came out bad.
Oh, no.
And it's terrible. I'm laughing. But you see this poor little guy, he can't straighten his leg out anymore. So he's stuck in one position. And that's the kind of thing that happens to a lot of my patients. People come in after failed surgeries. And then we can still hopefully get them better. I'm not allowed to inject my poor puppy. But actually, he's not a puppy. I call him a puppy. He's 13 and a half. What they say, a little long in the tooth.
Wow.
Yeah. But Bella's only 12, and she runs like a bat out of you-know-where. And we're going to go up, it's such a gorgeous day, we're going to go up hiking and running and have a great time. And I'm going to be lifting weights today and all the other good stuff I like to do, maybe hit some golf balls. And I want to give out the phone number so you guys can talk to me live right now. And the phone number to the studio is 866-870-5752. Go run and get your pencil and paper and write this down. I'm going to repeat it again. 866-870-5752. And for calling in, I'm going to give you a free copy of my very erudite book called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. And I think it's an amazing book because this book can save your life.
It can.
It can.
264 scientific studies. Would you like to talk to someone with a shoulder problem in Alabama?
Why not? Shoulder problems are just like everything else. We heal them up every day, and hopefully we can help you too. So let me go to the call screening. Let me see.
We have Tila.
I can hear you, but I don't know if you can hear me. Can you hear me okay?
Yeah, we hear you great, Tila.
Great. Okay. Yeah.
So I'm looking here. You have it's a shoulder issue for a family member. Who is that family member?
It's kind of interesting. I called you a couple of weeks ago, and first of all, thank you for sending me the book, and then also the age management medicine concerning the hormone replacement. We were talking about osteoporosis at the time.
Okay.
And then I had the other question. Yeah, because these are fascinating. I hope I can share them with other people. I don't think you'll mind if I let other people read these.
No, that's fine.
But the question I had is my brother-in-law had a severe motorcycle accident, and it took his shoulder. The one thing that didn't go well at the very end was he lost all movement of his left arm. And they did a 12-hour surgery March 31st where they took all the nerves and rerouted them from one arm to another.
Okay.
And the problem that he has is his shoulder's been out of socket ever since last August when he had the accident. But if you did your type of therapy, I mean, is that possible to do your type of therapy to make his shoulder capable of going back into socket and holding? Because right now it's still in just a a sling. They can't, and it takes 1 to 2 years for them to see if the nerve surgery will work. But if your type of surgery is possible, I want to let him know about that, where he could actually, they don't put it back in there, they said, because the shoulder it can't hold it.
Okay. So it's dislocated then, it sounds like.
Right. It's all out of pocket. Right.
And how long ago, Tila, did the accident happen?
August 22nd of 2022.
Okay, so it's been about 9-10 months or something like that.
Right. And then the surgery for the nerves was March 31st, just recently.
Okay. So I don't have an answer for that. I never have an answer for anybody until I examine them, which is unfortunate, because even if it's something simple, this is not as simple because that's severe motorcycle accident. But even if it's something simple, just like a rotator cuff tear or something like that in the shoulder, or labral tear, I can't promise anything to anybody, but at least I can give them a good idea. With this issue, because I haven't talked to or actually examined, is more important, your brother-in-law,
Right.
I'm not able to tell you what the chances this can help. I can tell you this. I have had tons of people with dislocated shoulders that I've helped, people that dislocate, but then they put it back in, but then it dislocates again. I had one young girl who was in a severe accident also, and her shoulder, her arm humerus bone would dislocate out of the glenoid joint several times every day, and I was able to help her with that. So it's possible we could help, but until I actually examined him, I wouldn't really know the answer.
And I'm sure he'd be interested in that as they see if the nerves if he actually gets any movement back with the nerve surgery.
Well, let's hope so. God bless the poor guy.
Yeah. Directly, he can call you, because they're actually in Texas, but they would easily be glad to go somewhere, even just to have an exam. Where someone could look at it and say, "Hey, it's possible to put this back and do this, that, and the other." But I can certainly pass this along. I just wanted to make the call and have some idea of what I can tell them.
And if you want to, you can just call the office now at 800-300-9300 and ask them to send you, or ask them to send him a book so he can read about what this process is of injecting stem cells or platelets to regrow.
Okay, now the book you sent me is the same book, correct?
Yeah. Mm-hmm.
Oh, okay. I'll send that to them, so you don't have to send another one out. I'll send this one to them.
No, I'm happy to send him another one. Just call the office at 800-300-9300 and tell them to send a book to your brother-in-law. They'll send it out today.
I'll call them right now. Thank you so much.
All right. God bless you, Tila, and thank you so much. I hope we can help your brother-in-law. Yeah.
Okay.
Good luck to him.
Thank you, Tila.
Whoa, that was a bad one.
That's rough.
So, by the way, I'm not saying that what I do helps everybody, okay? And I'm not saying that surgery isn't needed from time to time. It's just that it shouldn't be done, in my humble opinion, on the littler things in medicine. When you have rotator cuff tears, meniscal tears, labral tears, arthritis, and things like that we can help by regrowing the tissue, the cartilage, the collagen, whatever it is. So surgery is needed a lot of the time. And this case with Tila's brother-in-law may be one of those, because that's a terrible accident off the motorcycle. Personally, I don't know why anybody rides a motorcycle. I see the worst accidents happen to people, and I feel sorry for all of them. I had a learning experience when I was in high school. I got on a motorcycle for the first time that one of my friends had, and I ran it up a tree and I fell off.
Ouch.
And that was the best thing that ever happened to me, because I don't think motorcycles are safe. I know that lots of people love them, and I had another incident when I was in medical school. There was no place to park, so I had a little, like a scooter, and I would go only on the side streets where there were no cars. And one day I took it to get some lunch, and in the parking lot there was a little oil slick, and I skidded. I was only going like a couple miles an hour, and the tire skidded, and I almost fell. I didn't fall, and that was it. I got off, and I said, "That's it. I am done. I'm never getting on one of those things again." And I haven't, and I don't plan on it. I think, our culture loves motorcycles, so it's not going to change, but there's terrible accidents I've seen. Degloving injuries where all the skin on the feet is just scraped off. I had one patient in the emergency room when I was in my internship where his whole body was full of gravel from a motorcycle accident. I had to scrape him with a wire brush. And he didn't really like that very much. I've just seen too many terrible accidents, limbs that have been, removed, and it's just dangerous to ride a motorcycle. It's dangerous enough to drive a car, right? But when there's no protection around you, that's really dangerous. And cars don't like people on motorcycles either. Because a lot of motorcycle guys, we all know this, they zip in and out of traffic. And it's real irritating. And look, I'm sorry for you guys that love motorcycles. I understand. It feels great to be on a motorcycle, especially if you have a nice sunny day. But a lot of my good friends ride motorcycles, and they've had accidents. I have people that come in all the time, patients that have terrible accidents. And that's just the way life goes, I guess. You make your choices, right?
That's right. Shall we give the phone number?
Yeah. If you want to call in to talk to me live, the phone number is 866-870-5752, 866-870-5752. You can call in and talk about your friends, family. If you're shy, pretend that you have a different name and use that. We don't care. We love you. And it's actually a service to call in because you're helping other people learn how they can heal without having a surgery. So again, I love surgeons. That's hard work. I just don't like a lot of the orthopedic surgeries that are done that shouldn't be done. And very often, almost every day I get people in who have come in after a surgery that failed, meaning they got worse, a failed surgery. And there's actually diagnostic codes for failed back surgery. That means that a lot of them fail if an insurance company has a diagnostic code. And most of the time when people have surgery and I examine them, I ask, did the surgeon ever touch your body to examine you? And they go, nope.
Wow.
They just looked at an X-ray, an MRI, or CT scan and said, look, you need to have a surgery. And of course, the patient doesn't know any better. And the good news is oftentimes I can still help them heal by doing PRP, this platelet-rich plasma or stem cells, or a combination, and regrow the tissue and help the area heal. Very common in back surgeries where a person comes in and they get worse, and then I do an examination, and it's something that I can heal very readily just by injections. So should I take any calls? I want to talk about the vampire facelift first.
Oh, yeah. That's a good idea.
Yeah, the vampire facelift is something that we do in the office that grows back the collagen on the face as we age. We get a little gaunt looking, and this regrows and rejuvenates the tissue on the face to make you look young again. It can also be done on the top of the head for hair thinning. It revitalizes the hair follicles that die with aging, or a lot of times it's hormonal imbalance. So I'll often just check the hormones too and make sure everything is in balance. Anything you got to say, Nita, or should I go to a question?
Well, I just want to remind people when you call in, you get Dr. Darrow's latest book for free, Stem Cell and Platelet Therapy, Regenerate, Don't Operate is the subtitle, and it has 264 scientific studies.
I love it. All right, so this one is something that we do almost every single day. I don't know why it's so common, but it is basal thumb osteoarthritis. So that's when you have thumb pain. But this works all over the body with arthritis, just injecting the area and regrowing the tissue. So this person says, I have arthritis in my right thumb and a candidate for basal thumb surgery. My right thumb will most likely follow, but is not too bad. I think they meant their left thumb. Yeah. Would I be a candidate for stem cell surgery? Well, first of all, what I do is not really a surgery. It's pretty much just simple injections. And then they asked, where am I located? I'm located in West Los Angeles, across the freeway from UCLA on Wilshire Boulevard. Basal thumb surgery, I wouldn't do it. I see too many people that have finger or thumb or toe surgeries where it fails, and then the people are in worse shape. And what I do by injections, and by the way, when I do this, we freeze the area with a cold spray, so hopefully you don't feel the needle very much. And I use what's called a 30 gauge needle. That's a teeny weeny needle. It's like the size of an acupuncture needle. And we just do injections right around the joint there. And those heal pretty quick. I don't know why the hands heal quickly, more so than other parts of the body, but the hands, fingers, toes heal very, very well. Fingers faster than toes because we're walking on our toes all the time, which keeps irritating it. And that's something that's interesting. Most of the failures that I have with my treatments are because of overactivity. And a big problem I have in talking to new patients is that they want to get right back and do their sports immediately. And they don't realize that it's the sport or the activity that often caused the problem to begin with. So they need to give it a chance to heal. So, I mean, to be honest with you, I inject myself after injuries, and I go out and do my sports again. But guess what? I can go back in the office the next day and re-inject myself. And most people don't want to do that. So it's always best to rest after a procedure and let the tissue start growing. Another reason for failures with regenerative medicine using platelets and stem cells is people take anti-inflammatory medicine for their pain or headaches, and that blocks the regrowth of the tissue. We actually need inflammation for the body to heal. So if any folks listening have had a sprained ankle, you don't get nervous about it. It just hurts for a while, but it gets swollen sometimes, and that swelling actually helps the healing. So I don't give people anti-inflammatory medicine very often, very infrequently, because the anti-inflammatory medicine blocks the healing. So those are things like ibuprofen. Another fault in the treatment, if you want to call it that, it's really not a fault in the treatment, but more so the patient's issue, is they don't get enough treatment. This is not a miracle treatment. It just makes sense by injections with your own cells, the platelets or stem cells. You can regrow tissue. How many times do you need to do that? I don't know until you're healed. And then another problem is that most doctors who do this work do not use ultrasound guidance, so they can't see where that needle is going. So if you're going to a different doctor, make sure they're qualified to use the ultrasound. I'm board certified by the ARDMS in ultrasound usage for musculoskeletal issues. And that was a rough test to take. I had to study for a long time. And then I'd say the final reason for failure of these treatments is what I'm going to call a bad doc. And that could be a nurse or a physician assistant or anyone else. They just don't know how to do what they say they're doing, and they don't do enough of it. I've been doing this work for over 25 years. I'm busy all day, every day. I think I've seen it all, and I inject all over the body, not just the knees, shoulders, or hips. There's probably nowhere I haven't injected for the musculoskeletal system to heal the joints, ligaments, tendons, and it works great. I've been doing it on myself for, actually, I was the guinea pig. I did it on myself first before I ever did it on a patient. That was over 25 years ago, and I'm doing great. I'm ready to go out and have some fun exercising today. So need anything to say, or should I go to another question?
Oh, how about another question?
All right. First of all, I'm going to give out the phone number because I love callers.
Yes.
And the phone number to talk to me live. And if you do so, you're going to get a free copy of my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. And the foreword is by the beautiful Suzanne Summers. And she wrote the foreword to this book. And then in another book, which is called A New Way to Age, And there's a beautiful picture of Suzanne on the cover of that. She's written, I think, like 18 books on medicine. It's amazing. She has an interview with me on page 302 of her book, and it's a very lengthy interview. It goes on about 15 pages or so, and it's all about the work I do. I've worked on her, I've worked on her family, and they've had very good success with regenerative medicine. So the next question I have here is on bone knees. And that is something that I'm not sure is a real thing in most people, but let's see what this person says. I need both knees replaced. Well, first of all, I doubt they need to do that, but let's read the rest of it. Completely bone on bone, I doubt that too. Scheduled surgery but have been unable to lose weight for one reason or another, so they won't do the surgery, thank goodness. Just finished radiation therapy for prostate cancer, and the hormone blocker shot has thrown me into male menopause, making weight loss impossible. Well, that's not true. I'm in complete agony, can barely walk, and both legs are starting to atrophy. Can I get any relief from your treatment? I feel like it's impossible to ask, but I need some help. Well, a lot of things in this question that I want to go over here. First of all, this person doesn't need to get their knees replaced. And there's many places in the world where they don't do knee replacements and people go on living very well. Most people that come in to see me that tell me they've been to an orthopedic surgeon and they need their knees replaced, they don't need to do it, and we've healed them up just by injections of platelets or stem cells. Completely bone on bone, they say. I doubt it. I hear that all day long. You can look at an x-ray and it can look like it's bone on bone, but then the person is moving the joint. That means it's not bone on bone, because if two bones don't have any cartilage, they're not going to move. Unable to lose weight because of one reason or another, prostate therapy with hormone blocker shot me into male menopause. Well, look, women in female menopause can lose weight, so why can't men? Same thing. Makes it more difficult, I agree, but if you cut down on how much you eat and you eat protein and vegetables and you cut out carbs, you will lose weight. I don't care what your situation is. That's just the science of what it is. So you can lose weight if you want to. It takes discipline. I know. I'm a pretty skinny guy. I'm about 6 feet, 170. But it's still difficult for me to lose weight unless I follow the discipline. And the discipline is eating less and staying away from carbohydrates. Carbohydrates are things like grain, sugars, fruit juice, things like that. And fruit. People go, but fruit's healthy. I go, not if you're overweight, it's not. Because it has fructose in it. And that raises up your insulin. When your insulin is high, you store fat. It's a simple process. So it is really easy to lose weight if you're disciplined, and if you're not, good luck. It's not going to happen. There's no magic to it. And then people say, well, I've lost weight before, but I gained it back. Yeah, that's right. You'll lose it, and then you'll gain it back if you go back to your old diet. As we age, our hormones decrease and they get out of balance, and we need to either replace them and get back in balance, or we need to be more disciplined. And a lot of people, like this gentleman who sent this question, is overweight, and he's not disciplined. And I don't put him down for it, but he's not disciplined. And he has excuses why he can't. A lot of people say, well, I can't exercise because I have hip, knee, foot, toe pain. Well, you don't need to exercise to lose weight. You need to stop eating as much and cut out the carbs. It's that simple. There's nobody on the planet, if they do that, that won't lose weight. It's just the way, it's the physiology of the body. Other cultures, the cultures that didn't have our type of food, stayed thin. They were hunters and gatherers. All right, we're going to the break. Give me a call after the break at 866-870-5752. You can also go to my website, www.jointrehab.com, and watch videos of me doing the procedures.
And we'll be right back after these messages.
You're listening to Living Pain Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.